Hello, everyone. Thank you for coming back again today. Tonight, we're going to talk about signs of pregnancy. Last night, we talked about using a fertility app, or what can also be known as a pregnancy tracker that can help you to track your cycles, help you to know when are times in the month that you can get pregnant. And so you have done that. You have worked on your weight, you know your normal blood pressure, you know your body mass index or your weight where you fall there. You have stopped all of your contraception or family planning methods because you're wanting to get pregnant. And now you're feeling and experiencing these things and you're wondering, I wonder if I'm pregnant. So, do you know some of those things that you can expect to feel or to experience when pregnancy is happening? I bet you some things that you're going to know for sure. You probably will start to feel a bit more tired than usual. Might find that you're wanting to take more naps than normal, or you just can't quite explain why you're tired because you weren't up that late last night, but you just feel tired. Then you're noticing, oh, my period didn't come. Or if your period did come, it wasn't as heavy as before. So I had some bleeding, but it wasn't quite like my regular period. I wonder if. The other is now you're starting to feel nauseated and you can be around certain foods and you just can't stand the smell of those foods. Oh my gosh. And this could have been a food that you really enjoyed, but now you don't even want to smell it. Oh gosh, my breasts, they're feeling different. They are more tender. They're not normally tender like this, but your breasts, you're feeling more full, that they're a little bit tender. Guess what? These are signs of pregnancy. You might also start craving foods that you didn't care that much about before, but now you really have to have this ice cream. You really have to have it. So then what you want to do at this point in time is to figure out, am I pregnant or am I not? You also might be experiencing some constipation. You might also be going to the bathroom, urinating a lot more than usual. Those are, again, signs of pregnancy. And so what I want you to consider is going out and having a pregnancy test done. These are all signs of pregnancy. You may have some of them, you may have all of them. But the one thing I want you to also keep in mind strongly is that in regard to the menstrual period, sometimes you can have some light bleeding or light spotting. And women often will mistake this as a period. And when you ask, okay, so what was that period like? Was it the same as your periods? A lot of time, the response might be no, it wasn't quite as long, wasn't quite as heavy. Well, that bleeding is from what's it's called implantation bleeding. And that happens when the placenta is implanting into the wall of the uterus. So you can get some spotting. It should not be bright red at all. But all of these are signs of pregnancy. You can, of course, we know that we can easily get pregnancy tests. So you might want to go and get a pregnancy test done. If there's some question about the pregnancy test findings, you may want to repeat that pregnancy test. You can also schedule a visit with your prenatal provider that you have chosen, that you want to help you through your pregnancy and birth. So these are the signs of pregnancy. Some of these signs are due to hormonal changes that happen in your body. The nausea and vomiting is due to hormonal changes, and it's possible to experience that for up to 4 months of pregnancy possible. For some women, it's a lot worse than others. Some might feel that nausea and vomiting only in the morning. Some might have it at night. Some might have it all throughout the day. That is one. The fatigue is also, again, changes in your body. Hope this will go away over time. You won't have the same level of fatigue, but then as you get later in your pregnancy, you will experience fatigue again because you're carrying around baby. Breast changes will continue throughout your pregnancy. Your breasts will change so that you're able to be able to breastfeed your baby once the birth has happened. The urination, the frequency of urination is because now the uterus is larger and it sits right on top of your bladder. And so as the baby grows, you're putting more pressure on the bladder. So therefore you need to go to the bathroom more often than usual. This will relieve itself some as the uterus grows up and out of the pelvic area. But if you have urination later in your pregnancy, you may want to check it out. You don't want to have any problems with any burning with urination because that could indicate a possible bladder infection. Food cravings is something that you probably will deal with throughout your pregnancy. So for dads, just be ready for that. She may ask for something that doesn't even make sense, but that's a food craving and that's normal throughout pregnancy. The constipation, again, because the uterus is sitting on the bladder and on the rectal area, it's placing pressure on that rectum. Also, the changes in the hormones in the body can make it more difficult and slower for food to move through your intestines. So what you want to do with that constipation is drink loads of water. Also have foods such as raisins or prunes that can help with constipation. What I want to pay a lot of attention to is drinking a lot of water during pregnancy, drinking at least 1 glass every hour. The goal is 12 8-ounce glasses of water a day. Often when I would see women who would come in and I would say, so are you drinking water? They say, yeah, I'm drinking a lot. I'm like, okay, so how much is a lot? And they would say, oh, I'm drinking like 3 glasses of water. I'm like, my dear, we need to drink a lot more than that. The water, drinking enough water during pregnancy will help to reduce swelling or help prevent any swelling that you have. It can also help to prevent constipation that you might get. Tomorrow, I want to look more fully at some of the normal changes that occur in your body during pregnancy. We've only just brought up a couple tonight, but I'd like to show you visually what your body looks like prior to pregnancy and all the changes that happen in your body as the baby grows. You're wondering, why am I feeling this? Why am I feeling that? Well, there's a good explanation for it as you look at how, as the baby grows, the baby is placing pressure on this organ or that organ, so you can understand, oh, okay, so that's why I have the shortness of breath, or that's why I'm having, just a little discomfort here or there. Once you can see that, then you can understand those things. So tomorrow we'll be back looking at normal changes in pregnancy. And I also want to move into the discussion of danger signs in pregnancy over the next few days. What I do want you to start thinking about, though, is who do you want to help you during your pregnancy and birth? We talked about this earlier on when we talked about risk factors, that it is possible to have a number of different providers to help you during your pregnancy and birth that you're going to hire using your insurance. You have choices about who is going to be your provider. And based on that, you can then start looking for them early, either, prior to pregnancy. Start looking, start interviewing, start looking at different sites for where you are interested in having your baby, so that you're not just kind of held captive to this is the hospital down the street or here. You would be interested in knowing what is the cesarean section rate at that hospital. Are there baby friendly hospitals? We're going to talk a little bit more about that. The other is to consider what is your insurance at this time. So, as we talk about getting ready to have a baby, beginning to experience the signs of pregnancy, we want to also consider what we need in the future in regard to who will take care of me during my pregnancy, who will help me through this birth process, and where do I want to have my baby. So thank you so much for your time tonight. I look forward to speaking with you again tomorrow, and have a really, really good evening. Thank you.